So the next thing you're going to open is going to be your sterile aspiration tubing. This is the tubing right here. It comes in a yellow box and it's one size fits all. You drop it on the sterile field, you hand this off the sterile field, and blue goes to blue. So this is your transition from sterile to non-sterile. Everything here comes attached. You don't have to attach anything. It comes out of the box just like this. It comes in the off position. So red is off, green is on. This is so when the pump is on, off the sterile field, the physician on the sterile field can still control aspiration. Okay? You're always going to have it at that negative 20 to 25 no matter what size catheter you use. Here's the catheter sizing. Everything comes packaged separately. This is the M2U00126 system. This is the smallest system. Here's the catheter and separator. They're all color coded, so blue goes with blue. M2U032, matching separator and catheter. M2U041, green, and M2U054. Now, in an average case, you might actually go through more separators than catheters. Just simply manipulating them back and forth in the catheter, they might get beat up. So you may go through a couple more separators than catheters. So we are all ready to start pulling some clot. Let me turn this on here. So here we have a flow model that has pig's blood in it with clots. The clot actually starts right here. This is just simulating some tortuosity coming up the internal carotid. I have a neuron placed. This is a 6 French neuron M2U070. You're probably going to have just a groin sheath with this neuron in place. Let me close this. So for the smallest 3 catheters, the M2U026, the M2U032, and the M2U041, you can use the neuron M2U070. So this will be the setup for that. So the next thing you're going to do, do you want to do this? Sure. Is to load, you're going to flush the catheter in the hoop, and you're going to load that with a guide wire. So I'm going to give you a guide wire.
So this is already flushed.
Yeah. So here's a guide wire. It's pretty beat up. I think this
So
is a synchro.
usually you put micro catheter or just go over synchro, go to the place. This is pretty. You can use this as a micro catheter.
Yeah, like if you want to distribute TPA or something, you can do it right through this catheter. Once you start aspirating on these catheters, though, it's not a good idea to start infusing anything through them.
Okay.
Because you could have clot that's parked in the middle of the catheter that you've aspirated out.
The volume is pretty beat up. You're right.
It is beat up. I don't sell guide wires. This is the only one I have. This just kind of gives you the idea.
Okay.
Okay. Okay. So if you want to bring it into the neuron.
And this is your flush.
Yep. So that's where you're going to be doing any sort of contrast injections would be through your base catheter. Hey, how are you? Good. Good to see you. Good. No, don't worry about it. You want to sign in?
Oh, sure.
They're filming everything, so.
Do you ever do microcatheter contrast injections?
Yeah, before you start
Before you
aspirating.
start?
Are you getting
Okay.
some resistance?
This is going.
Okay. So go ahead and keep advancing it. Okay. So we're going to bring that all the way around that little loop there, just proximal to the clot. Perfect, and park your catheter right there. Alright, so once you have the catheter proximal to the clot, we're going to pull the guide wire. And each catheter comes packaged with the M2U00126. You don't have to use our M2U00126s, but this is the one that ours comes packaged with, so put that on the end. Throw my guide wire over here.
And through the two, you put this
And
up.
through the M2U00126 put the separator. Yep. This is all done when your catheter's parked proximal to the clot.
You use an introducer to put this up.
Yep. Use the introducer and bring that all the way up to the hub of the catheter. Yep. So there's that.
So that's That's like an introducer.
Yep, so the introducer comes packaged with the separator. The separator is this wire with the cone on it here.
Okay.
Each catheter has its corresponding separator,
Yes.
so you don't mix and match, so every catheter size has its own separator.
Nice. And this is the microwave that comes with it.
Yep.
Okay. Is that an 014 or what is it?
This is an 018 tapering
Oh,
to an 010.
okay.
There's a little resistance here. I'm bending.
Which one up?
There is a resistance. Maybe hub.
Is that done too tight? I'm gonna put this on here just to save your fingers. Oh, did I lose it already?
Probably.
So they're still sterile. They're magic. They stay sterile even if you drop them on the floor.
Sprig's blood. My fingers are getting
Do you want gloves?
Sprig's blood. No, that's fine.
No resistance?
Mm.
Okay. You can hand me the introducer then. You can slide it out.
Only that way to play.
Do you have to shape this wire or?
No.
No, you don't. Okay.
You can if you want to.
Is that neuron?
Yep, that's a neuron
So-
070.
You can
So it
concentrate
comes
here
with a
or
neuron
there.
assembly? Is it?
Everything's packaged separately.
Okay, but,
But-
you would need
but-
a neuron with it.
Yep, the three smallest ones will go through a 6-French guide. The largest 054 you're going to have to put through a 6 or 7-French sheath. So I'll show you a picture that shows all that.
Okay.
Alright.
So
Now you're gonna
once
bring
it up.
I'm
There you
coming
go.
to the hard part means I'm
Yep.
reaching the end.
So you're going to see a transition point. I don't know if you
Yeah,
want to show that
yeah.
on camera, but there's a transition point here that you go from green to silver, and you can actually feel it.
Yes.
And as soon as that goes through the TUI, you know you're about 5 centimeters from the tip of the catheter.
Okay.
So you don't have to stay on the row the whole time.
Oh, I see, okay.
Nice.
Okay, so you're going to bring the separator. This is all done before you turn the pump on.
Okay.
Leave the catheter where it is and bring the separator outside of the catheter. Okay, perfect. Stop. A little bit
So
further
just
out.
outside
Yep. So what you're going to want to see, I'm going to bring it out a little bit.
there. Into the cloth. Okay.
You're going to want to see space between the tip of the catheter and the separator.
Yes.
On fluoro, what it's going to look like is this is all radiopaque from here out, and the tip of this is radiopaque. You want to see a gap between the separator and the tip of the catheter. At that point, you backload the torquing device. This torquing device also comes with the separator. And then you hub it up to the TUI. What you're doing is you're setting your distal throw, so that you make sure that you're not losing that separator as you manipulate it in and out of the catheter.
Okay.
So then practice the technique right here, just bringing the separator all the way in
There.
and all the way out. Yep. I would say early on, in early cases, this is for some reason the number one thing that's missed. You want to make sure that separator gets all the way back in,
All the way back.
all the way back, keep going, and all the way out.
Okay.
You want to make sure that it can do that.
Yep, you just want to make sure that that's the technique that you're doing, because for some
Okay.
reason, here's two things that commonly happens. People get the separator right up to the tip of the catheter, or then bring it all the way in, or they're leaving it in the catheter. If you leave it in the catheter, you're never aspirating
Never mind.
anything. It's occluding the catheter, so you want it completely in and completely out. And it's about 1 stroke per second, just like this. Okay? So, what we've already done here is we've connected our tubing. You want to make sure that the TUI here is tight enough.
So the tubing goes to the
Catheter.
catheter,
Yep.
reperfusion catheter.
Reperfusion catheter. And then this end of the TUI, you want to make sure it's tight enough that you're not pulling air, but loose enough that you can still move that wire back and forth.
Okay.
Okay? And I'll show you, you can actually hear it when it's not tight enough.
Okay.
So what we're going to do is with the separator out of the catheter, before you're even in the clot, you're going to turn the pump on.
Okay.
You're then going to turn it on here.
Yes.
Okay? Then with the separator out, you advance the catheter up to the clot. What you're watching for is right now you're going to have high flow.
Yeah.
It's hard to see with saline, but there's little bubbles. High flow coming through because you're not in the clot. As soon as you occlude that catheter with clot, everything, all your bubbles, if you look at this bubble here, everything's going to stop. As soon as the blood stops in the tubing, you know this is where I start using my separator.
Oh,
I'm moving in
You're
and out.
breaking up the clot in your
Yeah.
separator.
So move the catheter until you are occlusive and then start moving
Yeah.
the separator.
Back and forth. So you can
Now
see,
came back, right?
so you can see now I've cleared the clot at that location. So what's happening in the tubing is now you're getting high flow again. So the main job that your tech or whoever's assisting on the case is to watch this tubing, because the tubing is your feedback to the brain. When it's occluded, watch what happens when I get up in the clot again. Everything
so I should
stops.
say, okay, now use separator.
So now you would know, okay, everything's stopped again, let's use the separator.
But you always have blood. So how do you know?
You can actually, little bubbles get in there, you can actually see it pretty.
You can.
Yeah,
Right.
yeah.
So even though it is all going to be red.
Yep, you can see it.
essentially.
So here's what it sounds like if, let me get out here. If this is too loose, can you guys hear that?
Yeah.
Yes.
Okay, that's what it's gonna sound like. It's gonna be air, all you're doing is pulling air in here and sending it that way. So you want it tight enough, you're not pulling air. Okay, so now I'm pulling fluid again. Okay, I've got pretty high flow with my separator out. So I'm going to advance. It's kind of pulling the clot already.
You're pulling with the
No, so now there it's occluded again.
neuron.
So I'm going to start manipulating the separator. Okay, now it's open. I've opened the vessel at that location, so the flow is picked up.
Do you have to wait?
Sometimes it takes a while for your feedback, because there's going to be a delay because the clot's going to move all the way out. But now, if your tech told you you've got flow again, you would advance the catheter. Okay, now it's occluded again, so everything's stopped. You see that?
Yeah.
So it would start working again. So the trick is, I'm going to move this camera down. The trick is to stay on the face of the clot. What you don't want to do is keep burying that catheter in the middle of the clot, because you need to stay on the face so that you have some flow for aspiration. Does that make sense?
Yeah.
So advance the catheter, it's occluded, start working there. Oops. Okay. And now it's picked up again. So in an actual case, I would say that lots of times you're doing one step forward, one step back, two steps forward, one step back with your catheter. It's not always marching forward, because sometimes you need to back up, like I did earlier, back up so that I can help clear that clot. You're using the blood flow to help clear out the system. I kind of kinked your wire here too. I can get you a fresh wire if you want. That was a little too aggressive. So I can, if I wasn't even looking at the screen, I would tell you you're definitely in the clot. Flow is starting to pick up. Now your true feedback is going to be when your separator's out of the catheter. So if you advance it out, I would be able to tell you easily that you're in an open vessel now. Does that make sense?
Because you're seeing the blood go through easily
Yeah, 'cause the
without
blood's
any
going through.
bubbles or clots
It's
inside.
going pretty quickly. The other thing, if you're questioning, you can also look in here. You'll see dripping. Any dripping is progress. Even if it's a very slow drip, you know that you're getting flow. So
What's the end point? When do you know that you should stop?
and like take a run.